So our next speaker is visiting us from Northern California. It's Marcy Darnovsky. She's the Executive Director at the Center for Genetics and Society. Welcome.
Thank you, and thanks for inviting me to be here today. The Center for Genetics and Society is a nonprofit public affairs organization, and we examine a whole range of human genetic and assisted reproductive technologies. And we do this from a perspective that we try to ground in values of social justice, human rights, and the public interest. And this is a perspective that we share with a large and growing network of colleagues across a range of scholarly disciplines, and also with public interest organizations across a range of fields, including reproductive, health and justice, racial justice, environmentalism, and disability rights. And for our organization, and I think it's fair to say for all of our colleagues, we appreciate and value the many applications of these technologies that benefit us, and we look forward to the promises of more of that. We also see that there are very profound and serious safety, social, and policy challenges associated with a lot of them, sometimes often really in very complicated gray areas. But we believe that there are two applications of these technologies that are so dangerous from a safety and a social standpoint that they should be taken off the table, and those two are human reproductive cloning and human germline modification. And this is a strongly held view, as you know, by many scientists, policymakers, public interest advocates, and others around the world. And the germline gene editing applications that are now imminent have been mentioned, and I think that really raises the stakes for our conversation and for the committee's deliberations on these mitochondrial techniques. And as we've just heard from Anlin, there is a very close relationship between allowing these mitochondrial manipulations and subsequent questions about whether a modification to nuclear genomes should also be permitted. So this particular panel, we've been asked to compare the issues raised by germline modification of mitochondrial content of nuclear DNA. And of course, there are important differences, but there are also important similarities, and I'm going to focus on those. The major intended use of mitochondrial germline modification techniques is to prevent the transmission of mitochondrial disease. And that's very similar to what the intention of germline modification of nuclear DNA is. The most often cited reason, at least it would be the early reasons, would be to prevent inherited disease. And we've been asked to think historically, and it's hard to do all that in 10 minutes, but I just want to comment that in the dozens of countries and the several international human rights treaties that prohibit germline modification, these prohibitions were put in place after careful consideration about the question of whether it might be a useful approach to preventing inherited diseases. And this question was answered, no, it's not a useful approach for reasons that I'll mention. So this is a respect in which there's really nothing new here. If the reasons for prohibiting germline modification that have been given in the past that do underlie these many laws and treaties still pertain. Another similarity between the two touches on something that's come up in a number of the comments, and I want to say, I want to put it in a slightly different way. Genetic techniques that treat someone who's sick, that's a medical treatment. These proposed germline modifications, I don't think they should be assessed as medical treatments. They provide a very real social benefit to parents. They answer the desires of parents, like who we've heard from, about having a genetically related child. But we shouldn't be weighing medical risks against medical benefits. We're weighing something different. This is about a social benefit, not a medical one per se. And while the desires of parents are clearly something that we should take seriously, they don't trump everything else, and that's what we're having to talk about here. Now, for the vast majority of cases in which people know that they're at risk of transmitting disease, there are effective and far safer alternatives than germline modification. There are problems with all of them. They've been mentioned. Adoption and third-party eggs do not provide a genetic connection with the mother. But PGD does, and PGD is more complex when you won't try to use it for mitochondrial disease than for diseases caused by nuclear mutations. But it is a viable option, and it's an improving option, and it's being offered in the UK, in fact, already. It wouldn't work for every woman with mutated mitochondria, but it would work for many. There is an argument about differences between germline modification of mitochondrial content and of nuclear DNA. And this is, it was very efficiently summarized in the previous presentation. Mitochondria simply provide energy to cells. Often there's the analogy that you can change them out like you can change the batteries in your laptop computer. And that it's just a small number of genes, doesn't really, so we shouldn't take it as seriously as we would take alterations of nuclear DNA. But there's another way of looking at that, I think, which is that we're talking about transferring 37 genes. The proposals for nuclear modifications are usually envisioned as a single gene. So in that sense, it's more extensive. And the other way is that these manipulations are very biologically extreme. You're taking the nucleus out of one egg or early embryo, putting it into another. Those manipulations raise safety and therefore ethical questions. And we really should be thinking of that as essentially the same process as is used in cloning or somatic cell nuclear transfer. And the biological sequelae of that are much better understood. And they're not pretty. So I'm going to turn to the question of, I think it's really a key question of why this line in the sand exists. And I'll talk in terms of lines. I think I'll try to avoid slippery slopes because that term is often scoffed at. I'm not sure why. I don't know why lines and slopes should be different. I'm enough of a mathematician to think that there's some similarity there. But I want to start with a few words. I think the line exists for two reasons. One is because it's a line that's clear and effective in technical terms, in conceptual terms, and in terms of policy. That's reason number one. And reason number two is because of the very widespread and very deep concerns about what's on the germline side of the line. So first, a few words about clear lines and blurry lines. I do think, and I'll just have to assert it here, that allowing mitochondrial techniques would seriously blur the line against human germline modification. And I'll say that this would be particularly worrisome in the United States, where, unlike more than 40 other countries, we do not have in law a prohibition against human germline modification. In the UK, I think people understand this, but it came to a vote in Parliament because the UK does have such a prohibition. And what the vote in Parliament does is it enacts a narrow exception to that law, although it's a very worrisome and significant exception. And I also want to just have to make a comment here and go on that the process in the UK, well, there's many admirable things about it. It was deeply flawed, and if we have time and there's interest, I would be very glad to tell you what I mean by that. So, okay, let's see. Okay, so why is germline modification so worrisome? I mean, one way to look at that is to look at the differences between using gene transfer to treat people who are sick, existing people who are sick, and using germline modification to allow parents to have children who are genetically related. The idea that, it's not a medical treatment, that there are alternatives in almost all cases. And I think that also an important thing is that there are clear differences in the ethics of experimentation and consent here. And, obviously the future child cannot make decisions, and neither can that child's descendants. And I think we should examine more closely the idea that this can be just met by invoking parental authority. I think that bears some real consideration. Then I want to turn to two risks that are broader, that are more broad, and it requires that we think about what we know about social dynamics, what we know about economic and commercial dynamics. And it requires, I think, also that we think about what happens if we permit human germline modification and the real, I think, almost impossibility of making a distinction between enhancement and therapy. So if we're going to be allowing germline enhancements, then I think we have to address questions about relationships between parents and children and whether having expectations of certain traits in our children would distort those relationships. I think that's a really serious question. And the other, even broader social consequence is the one that, to me and many people that I work with, the most disturbing. And here's where we have to really look at how we could anticipate that these enhancement technologies would be spread through the normal workings of commercial dynamics in a competitive, market-based society. So the nightmare scenario here, and one that is considered likely not just by opponents but also by proponents, is that the already privileged would undertake germline procedures to enhance or to purportedly enhance their children, and that we would see the emergence of entirely new kinds of inequality and discrimination in our world. The emergence perhaps even of genetic haves and have-nots. And for many of us, that is the crux of the matter here. So to conclude, there's really nothing arbitrary about the broad international agreement against human germline modification, and there really is little difference between germline modification of mitochondrial and of nuclear DNA that could justify crossing this threshold. As with proposals for other kinds of germline modification, mitochondrial manipulation techniques have not been shown to be safe. There are alternatives in most cases. They would constitute experimentation on non-consenting people, and they would all too easily open the door to further germline modification with social outcomes that could be really disastrously pernicious. Thanks.